almost look like craters, but they're not craters.
Hi, Sandy Stillmark, University of Colorado, Steamboat Springs. I'm Sarah Lipowitz, Colorado Center on Law and Policy, and my cousins live in Crested Butte, so I'll let you visit them.
Hi, Todd Jorgensen, Denver Human Services. I love going to Salida.
Ken Barrows, Colorado Legal Services. My wife is from Denver, so and we started going to Breckenridge, so it's someplace I always look forward to going to, even though I've only skied a couple times in my life.
Amanda Mercer's Colorado Department of Education School Nutrition Units, and I would say Mount Princeton, near Buena Vista, Salida.
Raleigh, Clayton Early Learning and Race Colorado Coalition, and I would probably say Strawberry Hot Springs and Steamboat Springs is my favorite.
And I'm Kee Powell with Department of Human Services, and Steamboat Springs is also my favorite place to visit.
Hi, Alexis Waitman with the Colorado Health Foundation. Already mentioned lots of good ones. Love going up to Snowmass. Also love going to the Denver Zoo with my 4- and 6-year-old. I'm Erin Ulrich with the Blueprint. I would have to second the champions.
Kevin Warner with Trailhead Institute and Lake County Basin.
Gina Ferraro, where do I work? Colorado Department of Public Health and Environment. I'm here today as a school leader. Just contribution to this effort. And A Basin, Denver Art Museum, and Crested Butte. I can't pick one, sorry.
Anya Rose with Hunger Free Colorado. I think I like Monarch Lake up by Granby. And can we go to the phone?
Yeah, so it looks like we have Felicia. And I think you're muted right now. Let me see. I'll see if I can unmute you. Does it work now?
Yeah, it works now. Thanks. Sorry for that. I'm Kalisha Crossland with San Juan Basin Public Health. Probably one of my favorite places is going to be Ice Lakes, which is a great hike. Whoa.
Sorry about that. And it looks like we have Brenda Heimbach.
Hi, Brenda Heimbach with El Paso County Public Health, and one of my favorite places is Breckenridge, Colorado.
Thanks, Brenda. And Terry?
Terry Chaston with CDHS, and one of my favorite places is also Rocky Mountain National Park.
Terry? Patty?
Patty Velasquez with Family Resource Center Association, and one of our favorite places is Glenwood Springs.
Thanks, Patty. Aaron? Okay, let's move on to Kristen.
Hey, I'm Kristen Fritz. I'm a fellow at the Children's Hospital of Colorado, and I think I'm still pretty new around here, but my favorite place is Missouri Lakes outside of Vail.
Thanks, Kristen. And then we have 2 phone numbers. So the first one ends in 3647.
Hi, this is Rebecca Ornelas with Higpuff, and my favorite place is probably Palisade during peach season.
Thank you. And then the other phone number is 3199. Okay, well, Erin, she said she doesn't have audio on the computer, but this is Erin Kendrick, and her favorite place to visit is also Salida. Is there anyone else on the phone? It looks like another phone number might have just joined us.
Yeah, this is Erin Kendrick. I just called in as well, so I could chat.
Thanks, Erin. Anybody else on the phone? Okay.
We just had someone else join us. Do you mind introducing yourself and your organization?
Yeah, I'm Shannon Coleman. I'm the Policy and Programs Director with the Colorado Association of Local Public Health Officials. Work Health Hub.
Thank you. And what's your favorite Colorado place to visit? We are doing an icebreaker.
Favorite Colorado?
Yes.
Probably Ouray.
All right. Well, thank you, everybody. Welcome. I want to briefly go over our agenda today and the purpose for the meeting. So last meeting, we went through survey responses from you all and various different project ideas for what this group could work on. And we did a prioritization exercise where everybody had $1 to spend on different options that we could work on. And then the purpose for this meeting is to take the top 8 options that people spent the most on and further prioritize so that we can come away with at least one initial project for this group to start working on. And Gina is once again graciously going to help us with that. Yeah. All right, the floor is yours.
Floor is mine. All right, wow, that was fast. Okay.
Introduction. Yes. Hi. We just finished introductions. Do you mind introducing yourselves and your favorite Colorado place to visit?
Hello everyone, my name is Nick Dean. I'm a server right now. And my favorite place in Colorado to visit, I like Roxborough National Park.
That's cool. My name is Cora, and I'm like Nick, I'm a participant. So I'm currently on WIC. I've been on SNAP in the past, and off and on. So my favorite place might be Red Rocks. I really like to go when other people buy my ticket. I like to go to Red Rocks.
Great, thank you.
All right. Okay, so what we're going to do today is look at the 8 different priority areas that were narrowed down for the last meeting. The remaining priority issues that were identified along the wall have been documented and may be revisited in the future, but for right now, we're just going to focus on the 8 that kind of rose to the top in last meeting session. And we're going to use a process called a prioritization matrix, which some of you may be familiar with. And essentially, there's kind of 2 axes on this matrix. For those on the phone, I apologize, you won't be able to see this, but before we get into the axes here and what they mean, what's important about this facilitation exercise is really the discussion and the analysis that results from thinking about feasibility and impact. It's not so much exactly precisely where we put this. It's really a tool to generate conversation and discussion about the 8 different potential options so that we can move forward in narrowing even further. I think Jack and Anya's thinking, if I may speak, and please correct me if I'm wrong, is that 8 is still too many things to try and move forward on in the next, 6 to 12 months or 18 months, and we need to continue to narrow. Is that a fair statement?
Yes.
So with that assumption in mind, we're going to go from 8 to, there's no magic number. We're not necessarily trying to get to 1, 2, or 3. I think we have to see what we learned from the discussion and how, what kind of the group consensus is towards the latter part of the meeting and see where we get to. So we're leaving it open in terms of what the goal is, but the goal is to definitely reduce our focus from 8 down to a smaller number. So in terms of feasibility and impact, what do we mean by that? So when we're talking about feasibility, we're considering things like, for this priority area, what would the potential cost be to do it effectively? What's the political community agency will or interest around implementing something such as each priority? What are the staff requirements? That could go back to cost. What's the evidence of impact? So is there research? Are there best practices? Are there examples from other states or other communities where this has worked? What about infrastructure? We have the technology, the resources, the organizational infrastructure for something like this to be feasible and successful in the future. And then when you think about impact, thinking about the goal of this work group and really the blueprint at large, so keeping those both in mind, of this work group is to increase SNAP and WIC enrollment. So what's the feasibility that we will have an impact on that goal through this or that strategy? And then secondly, to eliminate hunger overall, right, is the overarching blueprint goal. So we'll be keeping that in mind as well. Now, we don't know a lot of these different factors like cost. We don't necessarily know community agency will around each strategy. We may not know the evidence. So one thing we tried to do in preparation, it was very last minute, so our apologies for that. We developed a spreadsheet with some key questions. And so some of you, and I thank those of you who did take the time to go ahead and put some information based on your subject matter expertise and maybe personal opinions into that, and we will reflect on what's there. There's not a whole lot, and I think there's been kind of a discussion between Anya and Jack and Aaron and other folks involved in the planning for this group of, there's already been quite some time spent coming together and investing your time and wanting to balance the need to move forward with the work with the need to do due diligence around gathering some more information before decision making. And it's a really tough balance, but I think one of the things that we're all depending on in this group, and I think it's a good time to voice any concerns before moving forward at this point, is that there's a lot of subject matter expertise in this room. So we have many state agencies represented, we have people from different sectors, different perspectives. So we're really hoping to lean on that expertise and throughout this discussion to uncover some of these things. The other thing is like, well, what do you mean by this priority? It could be this, it could be that, it depends how we shape it. All very true. Again, I think you have to in some ways just trust the process, and as we learn more and we have discussion, those things that seem more feasible and impactful will rise to the top, and it just happens. So I'm just gonna put that out there for us to all kind of consider, because if you're a kind of a more black and white thinker, this is gonna be really hard. And I'll just say that up front, because this is not an exact science. So with that said, can people feel like they can get on board with this approach for right now, versus doing more research between now and like the next meeting and then coming back? And sounds good. It's okay. All right. I see some head nodding. So let's see how we do. And if there is a decision point where we come out with 4 and we're like, well, we really need more information about a couple of these before we move forward, we can always do that as well and collect more information and data to inform our thinking. So, okay, so that's with all of the background and caveats. Folks on the phone, just please remember you're an integral part of this conversation. Please interject with the chat or through the phone if you have some input to contribute. And we'll try and take some breaks periodically as well to turn to the phone to give you a chance, because it's hard to jump in, I know, when you're not in the room. So we're going to kind of just kick it off. Are we ready? So here's what we're going to do. We're going to take each issue. This one is higher minimum benefit. So the first step is clarifying that everybody understands what this could mean. And we're not necessarily deciding on exactly what it means right today, but what could this look like? Higher minimum benefit. And actually, let's go to the sheet, because some people already weighed in on this, which was really helpful. So if you look up here at the screen, let's just read through this really briefly. So there's a number of ways that benefits could be increased to improve SNAP's ability to end hunger and expand program participation. One of those ways would be to increase the minimum benefit, which is currently just $15 a month. Several other states and jurisdictions have raised the minimum benefit for certain populations, including New Mexico, the District of Columbia, and most recently Maine. So, and this was Mark's comment. Mark, are you here? Mark? Okay. Would there be support and interest from stakeholders, organizations? So this is his thinking. He thinks that there would be widespread support for this effort, as there is a lot of frustration by those SNAP recipients who only qualify for the minimum benefit, and there's general recognition that benefit amounts are not always sufficient to ensure that SNAP recipients do not go hungry over the course of a month. Those receiving the minimum are often working individuals or seniors on a fixed income. And is there current or future funding available for this work? In addition to the option of utilizing state general revenue for this, other states have utilized TANF funds to bolster benefits. So that's some background information provided by Mark. And then Anya had also included, Maryland also raised the minimum benefit to $30 for older adults 62 plus. And then Sandy, I know you're here as well in the room. During the stimulus, benefits were raised and health benefits improved as a result. The roadmap to end child poverty by the National Academy of Sciences recommended increasing.
Benefit by 30%.
I can't see where you're reading. Oh, okay.
Yeah.
Recommended increasing the SNAP benefit by 30%.
Can I ask a clarifying question on that, Sandy? When you say benefits were raised with federal dollars or general fund dollars?
I'm not sure which. What did they do for the students? It had to be federal.
I would assume it was federal, but the state could have opted to choose to do something at that time too. So
I think it was federal.
Okay, that's just helpful clarifying information.
Yeah. Any other questions, clarifying questions about this? What else could this look like? Anything else?
Todd from Denver Human Services. I was just wondering if either Kiki or Terry could maybe provide a little more kind of regulatory context, like what would that look like? It sounds like maybe easier to use state funding to do that. And maybe that was the case temporarily with the ARA funds. I think I remember that. So do you guys have anything to add to that? Just like what would it take to get the feds to allow us to do that?
Yeah, Terry, if you're on the line and can comment on that, I think you would be better to answer.
Sure. Can you guys hear me?
Yes.
Okay. So with ARA, what they actually did is, I think most of you know that every year there's an annual COLA increase. What they did with ARA in that first year is they gave the increases all at one time, and then in the subsequent years, there were like 2 years in a row where they didn't increase the benefit, and so it temporarily did increase the benefit, which is a little thing with ARA.
So Terry, just to repeat what you just said, they chose a year to increase the benefit greater than they normally would, but then held off on subsequent years so that it kind of equated itself over time?
That is correct.
Got it.
And then for those other states who have added additional benefit, it's not actual SNAP funds, it's, as was mentioned, general funds. I'm not aware of FNS ever approving a higher allotment. It would have to come from state funds, and the mechanism would also have to be a little bit different. Like it wouldn't run through the normal benefit. What I understand some of the other states have done is they have added it to the EBT card as more like a cash benefit, with the intention of it being used for food.
Which would make sense why other states have used TANF.
Yep.
Did that answer your question, Todd?
Yeah, thanks.
Any other clarifying questions in terms of what this could look like or what it would look like before we get to kind of thinking about feasibility?
I was just going to say, so I think if we want to if there's clarifying questions around SNAP, we should absolutely talk through those, and then whether or not we would want to apply this to WIC as well was part of that conversation. I was just clarifying question. So for the other states that have done this, has it been for certain subsets of the population or across the board, or has it been some mix? I guess that would be something we'd have to dig in on.
I can't speak for all of them. I know in Maryland it was just for older adults who were 62 or older. I'm not really sure why they did the 62 or older, because older adults are considered 60 and older for SNAP. I believe that the others also focused on older adults or people with disability, but I'm not sure of all of them.
Okay. And then I guess one other question I would have, and this may be more getting into research, but are there options if we could document cost savings and other programs to take those dollars to, so it wouldn't be new general fund dollars necessarily, but if we could demonstrate the Medicaid cost savings if someone's enrolled in SNAP to offset those funds and add some extra benefits. I have no idea.
Good question.
Yeah. Are there creative things other states have done?
Let's start a parking lot, because I think we're going to come up with different kinds of research and information that we might be really helpful in the future to look into. Let me put it. We might have some over there.
Did you say 40, 60?
I would say it could be a cost, a saving mechanism, right? So like if 16 over was too much money to ask for, then you start adjusting the proposal, right?
Do you want to share
It
that
just
loudly
seems-
so people?
I'm so sorry, right, so Anya had mentioned that she wasn't sure why they chose 62 and older instead of 16 and older, and I was saying sometimes when we're budgeting or requesting dollars, we make adjustments, right? Because they're only gonna give us $1 million, so if we only have $1 million, we can make 62 and older work, but we can't make 60 and older work, right? So that's just a gut instinct that I don't know is true.
Isn't 62 when you can start applying for benefits? I don't know
Social
if
Security.
my father just is in that.
Oh.
And so 62 is when you start. So I like, to me, like that's what a senior would be, 62. Side note.
Yeah, that makes sense.
Then it coincides if people are starting to use Social Security.
Mm-hmm. So yeah, so he retired and he's only on fixed income.
So it aligns with another program. And I think one thing to note just for the WIC benefit is that if it were feasible, and Erin, you can speak, the other Erin can speak to this better than I can, but if it were feasible, it would probably have to be added to the fruit and vegetable cash value. So it wouldn't, because WIC is so prescriptive in terms of what you can purchase, that would probably be the most logical place to put any extra funding.
Hi, yeah, this is Erin. I'll have to look into that. I don't think that states have the option to adjust the food package, but I could be wrong, so I'll definitely check into that. And I don't think Sandy's on the phone today, is she?
Sandy's
Sandra. I'm sorry, Sandra Clark. Is she on the phone? Yeah.
No.
Okay, because she could speak to that too. But yeah, I can definitely look into that.
So in terms of feasibility, and I'm not sure if we should split this into like feasibility for this happening with SNAP versus happening with WIC. What does your gut say? Should we talk about it in general terms or split the discussion out?
I think we can talk about it in general terms.
Okay.
I guess in my mind, this is going to be very expensive to accomplish. I don't have precise numbers, but I think we can safely assume it would be something north of $10 million a year. And so the question then I think for us to consider is if we could get those funds allocated for this purpose, is raising the minimum benefit the best use of all of that money? And if so, does it make sense to try to restrict it to the purchases that are allowable under food stamps and try to emulate those restrictions? Is that going to make it more politically palatable? Or is there a benefit in just having additional general funds to support cash assistance? Those are the questions in my mind. I don't have the answers necessarily.
Well, and more questions without answers. I'm interested in hearing people's experience or thoughts on, the economy is one way now. It may be different 6 months, a year, 18 months, 2 years from now. And when the Great Recession occurred, there was different political will in different ways. And what might happen? If that happens again, and hopefully not something so great, but the cycle always turns, does feasibility in terms of money go up or down? And what might that imply?
Well, SNAP is inverse economy, so the cost would increase with the recession, even if we don't do this. And then if we do this, even more.
And feasibility-wise, though, might there be more willingness?
Might be more
even though
will,
it'll be
but the cost would be substantially higher too. And then, part of the other thing I think to think about with this one is that in terms of ending hunger, no doubt more money to get closer to fully being able to afford your groceries is great. There's also the indirect impact, and that as you get more money, more folks might be more willing to do this. So that's how it's more directly related to this particular work group, I think. But that's an additional cost. So not only more per person, but more people because you're getting more. So I think this is a great thing for us to talk about. It is going to be pretty expensive.
Say, this is Alexis, just thinking about feasibility. I think anytime we're talking about state general fund dollars, feasibility it's slow. It's very challenging to ever get state general fund dollars. But I think the questions in my mind again would be like, are there creative financing options that we could look into? It feels like there may be some appetite to potentially segment out different populations that could reduce the cost if, you know, maybe you document the case. It also seems we'd need to have some good data and some cost benefit analysis and sort of thinking about the multiplier effect of having more dollars in the state and some economic benefits. So I think we'd have to be creative about how we would make the case for this. I wouldn't say it's impossible, but I think we would need to be very strategic and thinking about how to stage that and how to make the case to legislators. And I won't speak for state agencies, but I mean, I think there could be some options.
And this is Erin Kendrick. I just wanted to say that WIC cannot adjust. I found out WIC cannot adjust the food package. We can't increase it or lower it. It's not a state agency option.
That pretty much tanks feasibility on that one, huh?
Well, kind of. I mean, I think that's where the, like Terry was suggesting, right? Like even if we got more funds for SNAP, you really wouldn't be putting it through what our existing mechanisms are, right? So I don't think you need to think of this dollar as the same dollar as a WIC dollar or a SNAP dollar per se, right? That could be part of the proposal, which makes sense why other states have used TANF, because TANF is a very flexible dollar. I will say, and I don't want to speak for participants because we have some participants in the room. Generally, we hear from participants that they prefer a cash dollar over a food dollar, right? Because it's just way more flexible, right? So I think Jack is right that if you were going to write a proposal like this, right, from a client-friendly perspective, I think they would actually be more interested in a cash dollar than a food dollar. That's just my gut instinct. Sarah?
If we're going to take money from TANF, I think we would also need to pump more money into TANF because Colorado is one of the states where TANF is hardly funded at all. And, you know, you could, if you're over 30% of the federal poverty level, you don't qualify for TANF. And in other states, it's 60% or, you know, nowhere is it anywhere close to 100%. But, you know, we're doing very poorly in the TANF department as far as money goes. I hate to drop Peter to pay Paul. That's all I'm saying.
Can I take a moment just to go back to the last comment about participant perspectives? Cora and Nick, do you guys have anything to add on the value of?
We were just chatting that neither of us qualified for cash benefits before, so I can see how on one hand that'd be great to like be able, if you can pay bills with it, that makes sense. Mm-hmm. But just my opinion, I feel like that would lead to people using it unwisely. I kind of like being forced to use it for groceries because, but that's just my current experience.
I would agree with that too. Like specifically, then I planned everything around then the grocery part of it, and then have to worry
I can use
about
my dollars for this because those are for that. And yet one time I did apply for cash benefit. I didn't understand the process, and it was you had to make like $50 a month. And so it was like, oh, I make more than $50. It was like really low. And I was like, oh, I didn't know the cutoff was that low. So it makes sense because you're in desperate need. So thankfully I have not been in that need. So I'm not sure.
Thank you for sharing. Sorry to put you on the spot.
That's okay.
Since you were here.
I don't mind. Yeah.
Thank you, Brad.
Other thoughts on feasibility and what about impact?
Is there an assumption here that the current SNAP benefit level is adequate for people not to be hungry? I ask that. This is Ken Barrows from Colorado Legal Services. Because if we assume that it's not, then this would be something that you'd almost have to do if your goal is to increase enrollment, eliminate hunger. If the current food stamp program, SNAP program, is inadequate as it is, then it would be your number one priority. So just throwing that out there.
The Urban Institute is a good question because I think the Urban Institute and Blaine Waxman and Craig Gunderson did a lot of study, and it only improves food security by about 65%. So, and in Colorado, since there are a lot of resort communities where the cost of living is higher, it's even lower there because the SNAP benefit is sort of a national standard. But I agree that it's problematic. I'll just say one other thing to respond to Alexis with the cost savings. One of my concerns is when we talk about Medicaid cost savings, we're always talking about short-term cost savings, so we automatically go to adults with chronic illness. And real cost savings, pregnancy and childhood, but that takes years to demonstrate. So that's one of the things I always worry about when people say, with the research studies to date, is that they're often skewing to adults with chronic illness.
What are other thoughts going back to, I can't see your name today, Jack? No, Ken, sorry, Ken. Going back to Ken's question, are there other thoughts or responses beyond what Sandy?
I mean, I guess one thing to just level set expectations about what the federal impact, federal philosophy of the program is, which is in the title, which is Supplemental Nutrition Assistance Program. So philosophically, it is not, from the federal perspective, supposed to be the full amount sufficient to take care of people's hunger. It's supposed to be supplemental. Now, I'm not saying that's right or wrong. I just want to be clear on that perspective.
Right, but although it's, and this is a normative judgment, but you go through the gapmap.org/calculator and you get down to net income, and it may be something like all you have is $200 left.
Yep.
And they still take 30% of that. This is something that you can afford. And it reduces your benefit commensurately. And I always thought, well, 30%, no one spends 30% on food, really. I mean, the average is under 10 probably. But the law says 30, and that's how the calculation's done. So I guess my rejoinder would be, yes, it's supplemental, but, from where they're starting, is that adequate?
So a couple of follow-up ideas. I mean, it wouldn't be that hard with some help from our state partners to price out exactly how much this would cost under different scenarios. So we could look at how many older adult and households with people that have a disability are currently receiving the minimum. And the way it would probably work is, let's say we try to raise the minimum to $30. So people at 15 would have to be made up $15 per month. People that are at 16 would get $14 boost, and so on. So it'd be a graduated increase. And I think the viability is going to depend on not just where the legislature's at, but probably the governor's priorities was the determinant factor and what got funded this last legislative session, competing against some of the governor's priorities. And so I'm not sure if there's someone in this group who might want to broach that conversation with someone from his office. I think another question for us is, if this is a goal that's going to presumably take more than a year, is this something where we think there are tangential benefits by just introducing this legislation, even if we don't expect it to be passed or fully funded? Or does that advance the conversation, or does that meet any of our goals just by introducing this? I'm not sure.
Just to respond to Jack, I think it would have some benefit. I think if part of the goal is raising awareness around hunger in the state of Colorado, I think there are a lot of legislators who may not have a firm grasp of what that looks like. So I always think that can be helpful. And then as for the governor's office, I think it was a big step forward to get the blueprint implementation called out in his priorities around the roadmap for saving people money and healthcare. So I think there may be some momentum and at least a foot in the door to make a push. And again, I think that's where some of the cost analysis could come in handy. But I do think there could be some political will with our current administration.
The other thing I would recommend is making sure that we get the other states' budget requests, so the ones that have done this already, because I assume they had to demonstrate a good argument as to why this was impactful. So like, why reinvent the wheel, right? If they have great arguments, great research. So I can have, the price out actually I think is not that hard, because when we implemented broad-based categorical eligibility, that was one of the populations we pulled out, was the elderly and disabled. So I know I have numbers on that. And I think we might have at the time even pulled out who was at a $15 minimum. So like, even as a rough estimate, right? Like, I think that's not probably too hard for us to get to talk about potential impact. Right. And I do want to say, if I'm like remembering this correctly, that we were surprised to see that it was way less elderly and disabled that were on a minimum benefit than the lore in the world had told us. Right. So, but that's all hearsay, and we can come back next month with some information on that.
Okay, so, and I submitted a request to Christine along these lines.
I can do that too.
So they might be in process.
Cool, great.
So for the purposes of today, and just where we put this up here is not a decision in terms of like the narrowing, it's just to get a sense of the discussion. So I'm going to start with Jack because I think he originally came up with putting this out on the table way back when. So if you had to make a recommendation based on all the conversation today, challenges to feasibility, benefits to feasibility, impact one way or the other, where would you start by putting this? And then we'll kind of hear what the rest of the group thinks. So this matrix, I didn't even go over the matrix really, but this low-high feasibility on this axis, and then low-high on the bottom impact. And so this is your high feasibility, high impact. This is your low feasibility, high impact, and so forth and so on. So think about each, and then we'll kind of put it somewhere.
And can I just ask a question?
Yes.
Do we have to vote on that today? So like,
Nope.
I think we have a good understanding of where feasibility might be, but with data, I think we could have a better understanding of impact, right?
And we don't need to make a decision on narrowing today if we choose.
I'm just asking.
Yeah, it's an excellent question. Thank you. It's a wonderful process question. So we don't need to make a decision on narrowing today if we feel like we have some key additional information.
Okay.
I think what we might learn, there might be some things that are like,
easy peasy.
Well, there may be a combination of things. There may be long-term really tough things that you want to continue exploring. There may be some things easy or tough that you're like, no, we're not doing, that's just not something we want to move forward. And there may be some low-hanging fruit that is like a slam dunk.
Got it.
So let's see where we wind up, and then we'll decide what to do before our next meeting.
Thanks, Gina.
So where should we put this? Again,
Probably the upper left-hand quadrant.
so over here, so low feasibility but high impact.
That'd be my guess.
Okay, so how do people feel generally, like right here in the middle? Does that look good to folks?
Isn't that low impact, high feasibility?
Yeah.
I feel like that's the opposite.
Sorry, other way.
Yeah.
Sorry. All right, you're paying attention. That was a quiz.
No, wait,
No,
low
go down
feasibility,
further.
high impact?
Low feasibility, high impact. Yes. All right.
Oh,
Where we
okay.
wanna put it?
Never mind.
Low feasibility,
Misunderstood.
high impact. Like here?
Sure.
I just wanted to make sure you're paying.
That's high impact, low feasibility, right?
Yeah,
Okay,
this is
yeah.
high impact.
That's good. Thanks.
High impact, high feasibility is up here, right?
Right.
Okay, all right, good. Excellent. I've used these things 1,000 times and they inevitably confuse me every single time. Okay. Okay, so here we go. So there's some potential action items, but let's circle back at the end and commit if we want to move forward on those, depending on how the rest of this goes. We might need to move a little more quickly, but I knew that was a big one, so I let discussion go on. And actually, I should just say, people on the phone, are you all in agreement with where we put this? I didn't even really create a space, I'm sorry. Any comments, questions? There was some input earlier from folks on the phone.
Nothing to reach out and then.
Okay, all right. Okay, so the next one is peak is not user friendly. So was there some background? Is there anything on the spreadsheet, Kevin, on this one?
Yeah, so Kayla brought this one.
Okay, so Kayla and Kayla, are you here?
I'm right here.
Hey, Kayla. Do you want me to read this for you?
Sure.
Okay.
Wait, before we go on that, can I just give a little background on how this appeared? So when Jack and I put together the list of themes and then potential project ideas that came out of our survey and previous conversations, peak not being user-friendly was a theme that we hadn't come up with a project under. And for the most part, we were sort of prioritizing and voting on projects. However, this theme got a lot of prioritization money on it. So it's the only option here that isn't really a defined project.
Okay.
Which is why I'm kind of like, say more.
Right.
Like, what do you mean?
We did not come up with a solution, so this one is.
Well, I guess define the problem is what I would ask.
Yeah.
Right? Like, when you say it's not user-friendly, what does that specifically mean? And that might be what the data is.
Well, let's read this and then we'll open it up for conversation. So thanks, Kayla, for spending some time. So what are existing efforts related to this area? So caseworkers, managers, FWSs, and CFEs, can you define those for people?
Yeah, so like, and different ways of saying case managers, so family service workers, community family engagement specialists, and then social workers and caseworkers would all be grouped into that. And that's just referring to the navigator training that DHS already offers. And a big reason, my understanding, is why they offer this navigator training in part is because the PEAK system is hard to navigate. And it's not only hard to navigate, but it's also hard to upload documents. It's hard to make changes to your application once already in the system. And so because I've been an FSW or have done case management, this clearly pops up to me as being an issue. And I don't really know how to define if there's one exact problem within this, but it just seems like, well, this is simple. It's just a systems change, just working on something that already is existing. But it's come up in multiple conversations with caseworkers and case managers and people that enroll people in benefits.
I heard 3 examples, but I only wrote 2, so can you just restate that? Changes to applications, upload documents as 2 areas of concern, and you had one other one.
Changes to applications, uploading documents. Oh, the communications portion of it is really confusing. So communicating with your tech or communicating with whatever caseworker might be working on TANF with you through the PEAK website is very hard. So you can like look up the emails and the communications you've had with people, but that's like what communications is in the PEAK system.
Okay,
Yeah.
Thank you. That's very helpful.
And does anybody know the status? There was somebody that was assigned to OIT, Nina Schwartz. Is she still doing like the customer experience role? Is that still happening?
I mean, yes, she is still there. I can't, she doesn't work for me, so I can't specifically speak to what she's doing, but she works in collaboration with us, and I would say that this is on the radar as a thing, so that's why I wanted specifics. And we can continue to talk about it. And it looks like Sandy had some good thoughts there too as well.
And let's just finish off Kayla's thoughts too around what are evidence-informed strategies. So qualitative research with PEAK participants would help inform what the actual issues are. And then Sandy had mentioned financial counselors at hospitals are enrolling patients in Medicaid in PEAK due to limitations of the system. Would there be support and interest from stakeholders in this area? Yes. And is there political will, federal or state, local level will? Other states have higher functioning portals and joint applications, which result in higher enrollments. And then number 6, what are evidence-informed strategies? Get CalFresh Get CalFresh app has resulted in increased SNAP enrollment. Sandy, do you want to say any more about that?
I will say Todd and I had a meeting with the people at Children's Hospital, and a couple of things were really interesting. That actually the financial counselors, and that's probably true of any hospital system, touch people more as a process of enrolling in Medicaid than all the food insecurity screening and referrals. The number was about 10 times or something. I mean, it was startling. And what they said at that meeting, and again, I know enough to be dangerous, so don't ask me the details, but that for some reason, you know, they're only enrolling in Medicaid, and that there's some system that they cannot see to see whether they can enroll while they're doing this Medicaid enrollment. Why not enroll in SNAP, WIC, and other benefits? Can you add to that?
I think you got it, Sandy. Maybe Key can say more about that, but it's, I mean, my understanding is that those folks are a med-only site, so they are, the way that we have organized that in Colorado is such that they can only process med applications.
Yeah, and it's really sort of a real lost opportunity because they have more financial counselors often than community navigators because financially it benefits the health system if they can sign up people for health insurance. So it's just something to think about, and is there a way to?
Sure. And then Todd, is this different from the conversation we're having on Monday with Maribel? Or similar?
It actually came out of the same group.
Okay.
We're talking about the adding infants to the case.
Right, yeah.
So,
Can you bring this up on Monday
yeah,
as
I will.
well so that we can problem solve with our HIPAA partners at the same time about this?
yeah.
So that sounds like a defined specific project in and of itself. I'm hearing two. I'm hearing one is like system improvements overall to make the system more user friendly for the clients and caseworkers and other people who are accessing it. And then I also hear this bigger project, oops, shouldn't say that. I hear another project of making, having hospital financial counselors and probably others have access to benefits beyond Medicaid, including SNAP and WIC. So that might be another project under this area.
And then I hear a third project, which is potential app.
Oh, and that's a whole nother
well, that's in
idea?
there, right? Listed right there about the CalFresh app. So Medicaid has an app, CDHS has an app, and so I hear that there's also a suggestion about how the app functions or our apps function.
And isn't MyCO Benefits working towards being able to do SNAP applications? Right now it just reports changes.
I was wondering if maybe next month it would be helpful to hear about the enhancements that we either have already rolled out in phase 2 or are rolling out in phase 3.
Will phase 3 be full applications?
Of course, I don't really know the answer to that question.
Do you know ballpark how many users are using the app?
You guys are going to ask me really hard questions. Terry, do you know the answer to that question?
Just to reiterate, how many?
I do not offhand, no.
Are using the CDHS app?
I don't have a number. We can get it, but I don't have it on hand.
And I'm not suggesting that it's perfect, but that may be a different problem of uptake, right? The technology may exist, but are people using it as a separate?
Can I ask what app you're talking about?
My Colorado Benefits is the app for food assistant, or more for the CDH side of the house, actually, because now I know LEAP is going in there as well.
It does say something, though, that participants have never heard of this app.
Oh, yeah, I mean, like, I have the Peak app, I think, and I have a WIC app, but I don't know that the
Okay.
I think the idea is it would manage any kind of a benefit that would come on an EBT card for the most part.
That would make sense.
So I think you can you could check your cash benefits, you could check your
Oh, so
SNAP
it's different
benefits
than
at
the
this
Peak
point.
one that shows my card.
It's different.
And different from WIC that shows my benefits.
Yes, but the idea is that eventually it would
And the
have the capability of
being all
It's
together.
my dream to have an app.
Right.
That's a really
And I just going back to sort of defining the problem as well, we've also really heard that PEAK and the applications and change reports and redeterminations that come in through PEAK can be very challenging for caseworkers to actually work because sometimes things get entered multiple times and it can be glitchy. And so we've heard that part of the reason it doesn't, people still get encouraged to come into an office is because PEAK is hard on both ends, not just on the user experience side.
Yeah, just that, Matt Krieger from Denver, just a few points that come to mind. So one is that, and you all may know more about this than me, but Boulder County, I think, does a fair amount of managing of sort of the development of PEAK. And so bringing that organization in and maybe getting some of their views on what further improvements might be made that they've been asking for a while might provide a source of information and give us a little more about what the potentials are here. In Denver, we sort of have I won't say a love-hate relationship with PEAK, but we don't encourage or discourage people to use PEAK, but what we find is people come in because they can get their benefits faster by doing that than doing
Right.
PEAK. And we're happy with them going through PEAK, but the reality is their business process allows them to get served, same day a lot of the time. and people sort of choose with their feet. Which in Denver, we're not sure if then improving peak means a lot more people using it for access. However, other counties, for example, Arapahoe, drive a lot of people through peak for some very valid reasons to get applications. So the way that peak is being used by different counties varies considerably based on what they want. So improving can mean different things to different parts of the state. So just a few things to keep in mind for what they're here.
And the other piece to keep in mind is that all of our outreach and application assistance, correct me if I'm wrong, but at this point has to go through peak for the most part. So whenever we talk about application assistance and our SNAP outreach, we're also talking about peak.
Through Peak Pro, right?
Through Peak Pro.
Okay, which touches Peak.
Which touches
I
peak,
just
but
wanna
it's
make sure
gonna
that I'm on
come
the same
in,
page.
it's gonna come in and a technician is going to be seeing virtually the same thing as if someone had processed the peak application on their own.
Do we know if OIT has a standing line item in the budget to make peak improvements each year? Or is that something that has to be requested?
That is good. I don't know that. I'm trying to think how that, Terry, are you on the line?
I am.
I'm trying to think about your question and how I answer that, sorry. It's not that it doesn't have it's like lumped in, I guess is how I would.
It's like the pool that.
Within the spectrum of all the funds we have to work on CBMS, right? It just falls under the CBMS.
So if you have a lot of federal regulation changes, you may not have any additional hours to actually make improvements to the system.
So I don't think we treat it separately from the.
So, does anyone on the phone have anything to contribute before we move on? It says someone's talking. Let's say Oh, okay.
Yeah, the room.
I was just going to say too, I'm happy to follow up with Nina Schwartz. I think her title is Client Experience Manager. So I think her whole job is to focus, or it was to focus on improving the peak experience for clients. So I can follow up with her and just see if she has additional information that this group could review and look at.
Okay. Just gonna put follow up with Nina, Aaron. Okay, so, oh. It disappeared. Oh, you're So, okay, this gets complicated then. So what I'm seeing is kind of a large potential body of work here. There's many projects that could fit under this. There were probably 4 or 5 already discussed today. I think the question is this area important to focus on if trying to increase SNAP and WIC enrollment? And then thinking about feasibility, cost, political, community agency will, FT, evidence of impact, infrastructure, technology, resources, organizational infrastructure, etc. Where would you put it here? And it's huge, right? So it's like, I think the question really on the table is this something your group should spend time on moving forward? But in light of the 6 other things that we haven't gone over yet also.
So
What are some thoughts?
I guess this, not to throw a monkey wrench in it, but
It's hard.
for this one, if we decided to prioritize it, I don't think we have the right people around. So OIT and counties need to be involved. And Denver's here, but so I don't know, even if we get it on this matrix, part of our decision-making process might be, what's the appropriate project for this group?
Great point.
I mean, I guess I'll share a slightly different perspective to that, which is I think this group, right, can say it is of high value and priority. Whether or not you actually have the ability to impact that is different.
Yeah,
Does that make sense? Like, so you could still vote for it, and it could be your top #1 thing to work on. But then if OIT and CDHS and counties aren't on board, it's like too bad, so sad, right? So.
And here's the nice thing is even if we narrow 2 or 3 today and you decide this group's on board, you're going to maybe form a separate project team. You're probably all not going to be able to do all this work together, right? Like just in terms of implementation. you might inform a plan and then, but then once you kind of move through implementation, if you hit a roadblock, like we thought we were gonna have political will and then we had an economic recession. I mean, you never know when stuff like that's gonna happen. And so it might be that you do have to change direction, even though the intent of the group was to focus on X, Y, or Z. And I think obviously that's just the realities of the work that we all do. So this might be one of those things where that's why you document and hold on to the other ideas, because you might want to go down a certain road and then realize it either will or won't work when you get more information. But knowing we have a super huge group in the room today and a lot of really important topics, how can we narrow enough just to go to the next step, which is a lot more research?
Could I suggest high impact medium feasibility? I say medium and not low feasibility because there are channels in place that we've heard about and there's some will in terms of resources to make this happen. Just enough to kind of get somewhere and move on.
Yep.
Everybody disagree with that?
Feel good about that? Good. Yes. Okay, excellent. Thank you for making that recommendation. Okay, so the next one. This one looks a lot more specific. Telephonic signatures to counties. Do we have anything on the sheet?
Yeah, we have comments from Anya,
Anya, do you want to?
Sandy.
Oh, and Sandy. Thank you so much, both of you.
I can just talk through
Go
it
ahead.
if it's
Yeah.
easier. So the telephonic signature is a statement of rights and responsibilities and a few questions that someone on a phone can read to a client, and it enables them to sign for that client and submit an application for them over the phone. So right now in Colorado, a few of the SNAP outreach partners are using this, and that's how we're doing applications over the phone. I don't think any counties are doing it, but counties in theory could if the practice were put in place. So it's not something that is set aside just for outreach partners, that's just how we're using it at the moment. Is that?
Does it require technology?
So, kind of, yeah, because there are some storage requirements. I think you have to keep it on file for a certain number of years. So I know there's definitely the piece of like 5 minutes to read through this and get someone's signature over the phone. That's in English, and longer in certain other languages. And then that file has to be recorded and stored for
5 years. And you have to be able to tag it to individuals. So, yeah, there's some technology requirements. It's not, I mean, for sophisticated counties, it's probably not crazy.
Yeah, I think the biggest thing would be time and staffing of call centers if a county were going to take this on, because it means someone's actually going through the application with them. I don't know if there would be a way if, let's say, someone called into a county call center, said that they wanted to apply, gave all the information, they fill out the application and then can submit it over the phone and then complete the interview. I don't know if they still have to like separate the application process from the interview, or if you could then just merge those two and say, well, this caseworker talked through every piece. So I think this would be much higher impact if that initial conversation could count as their interview.
Todd, do you want to say anything, or Matt?
Well, I was going to say, one thing to consider here is the work group is increase and maintain enrollment here, as I understand, for a goal. And I actually see this as an opportunity to maintain and reduce churn, just as much or more so than applications. Most of the county work is actually redeterminations and keeping people going, not the initial application. So whereas I understand some of our outreach partners, understandably and thankfully use this for applications, it's actually the redeterminations where this may have as much more impact.
That's an incredibly good point, Matt.
Yeah, because that, and so there's benefits, again, for people getting there are benefits to getting their benefits quicker because they don't have to go through the paperwork, and for the county, it's the same thing. We don't have to process the paperwork. And preparation and processing of the paperwork, and even if it's in an electronic system, is very resource intensive. So we see this as having a lot of potential to help streamline things on both sides.
And Terry, can you speak to our efforts on this already, please?
Yeah, sorry, I lost my connection for a little while. So we really have started with our outreach partners, as Anya said, to try to perfect this. It is, as I already noted, a technological thing for the counties to be able to store this. Back to Anya's question about interview and the application, and states who have implemented this, they are able to do the interview and the application at the same time, which is a huge time saver. So we are, I think, at the point right now where we are starting this discussion with the counties to see what counties would be interested in piloting such a thing.
Terry, in terms of the regulatory landscape, if a county wanted to do this and had the funds to get the technology, do they have to, is there a federal waiver that would be required, or are there any state regulations that would have to change to allow for this?
No, it's actually just a state option. And in fact, when we updated our regs recently in the technical rewrite, we did, in the section where we talk about signature, it does allow for a verbal signature already. We had to do that in order to accompany what our outreach partners are doing. So our regulations are already set to be able to do this.
And then in terms of pricing it out, do you have any ballpark sense of how much it would cost a larger county to do this? And if there are any funds available that could be used to support it?
I don't know cost. It probably depends on what software the counties already have. I imagine the counties may already have the ability to store and record their calls. A lot of the call center technology allows for that. So it would just be a matter of being able to store those recordings. We also have to be able to send the client a copy of their application. So ideally, I think to make the process the most efficient, there would probably be some CBMS changes in order to simplify that process, as well as simplify the ability for the worker to do the application and the interview at the same time and get it documented together. But did I answer your question, Jack? I don't know if I answered it.
That helps.
Terry, this is Gina. I have a question as a facilitator. Is there a role for this group if your office decides to move forward with this?
I'm sorry, say that question again.
Would there be a role for this work group should your office decide to move forward with this independently?
Yeah, we could move forward independently. I don't know that we would need the work group. Added support from the work group is always helpful when you're making a big change.
So I'll add to that. This is Key. So yes, I think support from the work group would be great, specifically support from counties to move this effort and explaining, from a county perspective, why they think this is an efficiency rather than, right, perhaps a additional work, right, I think would be incredibly helpful. The other thing too is that the way that enhancements work in CBMS is that, we get money, right, and then we have to use the money we have to do all the things we have to do. Priorities for that money are all the federal, right? So there's a heavy breather. So like Aaron was suggesting, if the Farm Bill made a lot of adjustments, right, we have to use the money first to adjust CBMS to address all of those kinds of things. So one thing that could be helpful is if we had additional funding to, like, say this was a really high priority for the group and we could work collectively to find additional funds that we could give to CBMS so that we could get this project done. That is a conversation that would be very welcome. And I can think of one example of that in which CHF last year paid for noticing to all of the SNAP recipients through the government shutdown, right? We didn't have the funds to notice all of those clients. It would, noticing every time we do noticing costs us, does anyone remember? Was it 200 or 150,000? We didn't have those funds on hand, and between CHF and another Gary Foundation, they donated those funds so that we could notice clients. So that's a great example of how this group could be supportive in that effort.
It's a one-time cost though, right? I mean,
I don't have that on hand because we haven't created a work plan, but I feel like the upfront costs are always more expensive than ongoing, right? That's my experience, but that would be more information for us to learn.
maybe this goes in the bucket of more information, but that was my question. If there was a role for philanthropy here to support something, would it be a county by county fix or would it be a statewide system adjustment?
Yeah, I think that would be more to learn, right? So it sounds like maybe some counties have this kind of technology maybe already. Or there's a question of if you were to just build it so all counties had the capability, right? You build it somehow through CBMS or PEAK or whatever, then what would that cost? I don't know the answers to those questions, but
This is Todd from Denver County, and we don't know either exactly, but, based on what Matt just shared, Carrie, whenever you're ready, we're ready to roll quickly on that. We'd like to do this. Matt and I were just chatting, I don't think there's a huge county cost, it's just in terms of a little bit for storage, maybe tweaking of our work management software or something. And if we could do it without, the CBMS changes would be helpful, but it sounds like we could do it without that. And so I think the biggest lift for us would just be adjusting our own business processes, which we do for various things.
To Anya's point, how do you feel conceptually about trying to combine the application and the interview all at the same time?
I think conceptually that makes a
Yeah.
lot of sense. Yeah, I wouldn't be that kind of, I think we'd want to tricky.
I'm not grasping yet how that's a real big issue here, because I think we try to do that all the time.
Right.
But we try to put those together as much as we can, 'cause it's more efficient for everybody. So.
And
I would
another
agree.
follow-on question, I may be diving too much into the weeds, but if it is a business process adjustment, would you, Denver's certainly progressive in this area, would you see potentially a role for technical assistance to other counties to implement those? So that could also be a potential funding ask
yeah,
of
one thing I would
personnel.
think we would probably do is if we figured out the capability, is probably like a summit or something, Todd, where we could do some TA, right, with counties that are interested in moving this. And I will say, when we had the government shutdown, one thing we did do was direct counties to our partners who had telephonic signature, like Hunger Free or BBT at the time, because we knew lots of clients couldn't get into the office to do some of the work. So we said, send them to Hunger Free or BBT, do the telephonic signature. So that is a world that exists today, but this would be even more efficient, right? Just to have the county be able to maintain that capability instead of sending them off
Yeah,
to come
and
back.
again, it's a world that exists today for applications, but not for that other
That's-
huge chunk of work.
Well, starting
Well-
next year,
Oh, okay, so you're planning on,
there's some exciting work we're doing.
So we can do it, it's not the big chunk of what we do, but, right, but it's a great point, and it actually may end up reducing your calls. When you think of how many calls come through for a single.
Yeah, redeterminations have become a bigger part of our business.
Yep.
We already do it with the people that we got into our system, and we're
Yep.
working with the state to potentially do it beyond that.
that's great.
Seems like
Okay, so I'm gonna move us along. It sounds like there's work that we could be building on, the regs are there, there's interest from at least the folks in the room who work at local county.
I would say hi.
Hi. So hi.
Yeah.
That's me.
Yeah,
Now, can I get this in the right box? All right, woo!
That's exciting, our first hi.
Everyone turn to your neighbor and give them a high five. Hi, Kevin. Yes. All right. Okay, the next one was another one that was high on the list, improve cross-referral coordination. So a pretty general area, but I know there's been a lot of partnership and discussions around this over the years. Also, I'm wondering if we need a 5-minute break. Are people doing okay? This is hard work. Doing okay? Hanging in there? Erin, Kendrick is Johnson, right? Kendrick Mary. Yes. Erin Kendrick, not to put you on the spot on the phone, but I think you initially maybe put this idea on the list to improve cross-referral coordination. If you're tuned in right now and can hear me and would like to offer any background on this, we'd love to hear your perspective. And then there's also some information here we'll go through as well.
Yeah, this is Erin Kendrick. I know I'm showing up as Johnson, but it's Kendrick. I was just strengthening partnerships so that, like, for instance, if Hunger Free is, referring or completing a SNAP application, that they're also referring the family to, or the individual to WIC. And so just kind of, and that's just an example, strengthening those types of relationships. So it's not a one-off, but it's added to the workflow for certain programs where it would be applicable. And vice versa, same with WIC, back to SNAP or Hunger Free. Does that make sense?
Yeah.
Mm-hmm.
So Kayla had some information here too. Service providers and case managers across the city and county have varied information and access to directly sign folks up for services, i.e. SNAP WIC. Many enrollment specialists in ECE, family advocates, and other case managers at shelter settings and in ECE settings have to refer out to a CCAP, SNAP, TANF tech to get families signed up, which is already a barrier. If we can link families to all services when they're already spending time on enrolling in, for example, a child care center, registering for school, doing an initial in a shelter, it may be easier to sign them up for everything. So families receiving services may already deal with losing time off work, using public transportation, and making it to multiple meetings to receive benefits. And then Sandy, do you want to mention what you shared here about overlapping criteria?
Yeah, I think Medicaid beneficiaries are both high risk for food insecurity. When we screened the Kaiser, 25% of Medicaid were food insecure versus 5.1 who just had Medicare for the seniors. So one, that's a high risk population. Two, they're income eligible for WIC, and 60% are income eligible for SNAP if they have children, and I think it's 50% for families, and it's lower if you don't. So it just, when we ran data in January to try to understand the gap in the state, there were 500,000 individuals who were on Medicaid but not SNAP. Wow. And so it just seems that there need to be processes, these cross-referral processes that are seamless that can help, such as the financial counselors that we talked about at the hospital. And I think the other thing that we're working on, and I'll just speak from the healthcare sector, there are two opportunities. The one is start using the financial counselors more effectively and get them able to enroll in all benefits. And two is working with Benefits Dev Trust to run lists for and partner with Hunger for Colorado and actually Human Services to have, are there ways to have on-site people to, instead of doing food insecurity screening, in addition to doing food insecurity screening, prioritize asking Medicaid beneficiaries, are you enrolled? Are you enrolled in SNAP and WIC? And if not, how can we target this population that has high food insecurity and are likely eligible for both programs and promote it? The beauty about asking them is the question is, are you enrolled? Because we know these programs will help improve your health. So it decreases stigma also. So I just think there's a lot of opportunities in this area. And I think we've learned a lot with our partnership with Hunger Free Colorado over the years, and a lot of the multiple handoffs result in drop-offs. And even your enrollment at Denver Health, where you have NIP in the lobby and it's doing direct, how do we learn the best practices where we have more direct enrollment rather than multiple handoffs? The last thing I'll say is when we did interview our Medicaid beneficiaries who were referred for food assistance, they were never clear who they were talking to because, and we would refer them to Kaiser Community Navigator, who then would refer them to Hunger Free, and then sometimes they'd be in the state. And just really, it's confusing in each area. There are big drop-offs. So how do we do a lean process and enroll people, enroll this population in a better way?
Thank you.
Can I add to that? To Todd from Denver County. I'm going to go out on a limb and just say, for one county's perspective and a county perspective, this would be a high, another high. Based on what Sandy was just saying, I mean, I think for me, saying it's high is based on this being really clear about the scope. The key word I see here is coordination. So maybe out of scope would be like trying to change the eligibility rules for both programs or whatever to more align them. But if we're talking about coordination, particularly around business process like we were talking about earlier, what Sandy was referencing, I think that's high feasibility because we, for example, we were already working with Denver Health to have a WIC person in our lobby 1 day a week. Matt was just pointing out, if we had technology, we could explore some relatively low cost technology solutions where we could Skype in a WIC worker who could then help us, we could work together on doing a joint application there. So I think there's some high feasibility there too, if that's what we mean by this.
One thing I would add, I don't know if this falls under cross-program referrals, but an idea that CCLP's health team has kicked around is trying to authorize the Department of Revenue, when they're sending out tax returns, they should know based on the size of the household and their income who's presumptively eligible. And so we had talked about trying to target those folks when their tax returns are being sent out with maybe a pre-filled Medicaid application. And I don't know if that idea could also work in terms of SNAP outreach.
What some states are trying to do with the SNAP outreach with that is actually tell them what an approximate amount that they might even be getting, which would even further encourage maybe people to do that. Yeah, that's a great idea.
Is that happening? Did you say that was happening in other states?
I think I want to say Maryland has done that for Medicaid, where they've used tax returns to target people. I think they have an auto enrollment where people are basically automatically enrolled if they qualify unless they opt out. But I don't know.
Wow.
I don't know.
Well, there's an idea.
And there's some exclusions that people, it doesn't apply to everyone, but.
Culturally, I don't know that would fly here in the Pioneer State, yeah.
I mean, we had talked at one point, like within WIC even, of just like, if you could identify that population and send I get credit cards in the mail all the time, right? You would call X number to activate it. Like if we could do something like that with an EBT card and pilot it to see what that would look like. Because I do think getting the letters in the mail haven't proved to be super impactful in terms of getting somebody from there to application, but.
Yeah, that's one of our methods too at BDT is reaching out to those. This is Sam with BDT, and that's one of our methods. Kind of looking and mentioning that benefit amount too. We've actually seen a good response rate with that. Kind of giving that benefit amount, you might be eligible for this amount, and it's kind of that call to action to get people to give us a call or to call their county office to enroll. So we have seen a little bit of benefits from that, and I do know. Kind of go back with the tax. We had piloted in Pennsylvania, actually partnering with tax sites where people were coming in to do their taxes, and then we had some on-site people as well there, helping them enroll into additional benefits, including SNAP too, and still in the evaluation piece with that, but saw some good feedback. Again, meeting people where they're already doing a similar benefit, might be eligible for a similar thing, to see some results with that as well.
Thank you so much.
This is Sarah from CCLP, and I know that some states do pay recertifications to different schedules, like they'll do the SNAP recertification at the same time as the Medicaid, or do the Medicaid at the same time as the SNAP, and they will send a pre-filled application with that. And so they do get good results on that.
Wow.
There's pros and cons to which way you want to go with it, whether it's on the Medicaid timeline or the SNAP timeline.
Lots of very concrete ideas, and I really hope someone's taking notes. I tried to capture some of them, but I certainly didn't get all of them. Too late. Everybody remember that. Are you taking it, Krista? Are you taking notes? Great, no, thank you. So I heard a recommendation from, who's sitting next to you, Matt? Todd. Yeah. Sorry, I can't see name tags from here. I apologize. And he's left the room, but his recommendation was high. based on some of these ideas that have been floated around the room. How do others feel about that recommendation in terms of putting that here? I can see a lot of heads nodding. All right, well, let's go ahead and this will share some space up here. Obviously, a lot of work still to define what that would look like. But there sounds like there's a lot of concrete options, so. Okay, the next one was text communications. We're on number 5. We have 4 more. Oh my goodness. I don't know if we're gonna get through all these today. We'll see.
We can do it.
We can do this? Do we need to talk about it, or is it?
No, you can get through 4.
Oh, I can get through 4 more. I thought you were like, oh yeah, we got this. This is a done deal. I was like, oh, great. Okay. Does anyone want to talk about what this means, or their background on this? Does anybody remember where this idea came from?
I guess we were thinking about text message reminders. One would be communications around the interview to let people know if their interview's coming up so they don't miss it. And the other one's just a reminder about the recertification are probably the 2 times it would be most helpful. Are there other times that I'm missing?
I get WIC text. Is that are you saying that it's a program you're currently doing, or that you
So
want
WIC
to
has
do?
it.
WIC doesn't.
Snap does not.
I thought Boulder has it for Snap.
I think some counties
some
are
counties are
statewide doing it.
Yeah, this is Terry. There's a couple counties that are texting. Arapahoe, Adams recently got the technology and they're starting to do some texts.
Yeah, this is Erin Kendrick. Yeah, WIC does appointment reminders via text. And if the client or family does not have any food benefits for the next month, but they're still active, they'll get a reminder that they don't have any appointments and to give us a call. So we do appointments like that. We also, another point to the text message is looking at two-way communication. So being able to text back and forth with the referral or client might improve, obviously getting a hold of them. And so that might turn into them showing up for their appointment. So lower no-show rates, et cetera. So we'd like to explore that over here anyways with WIC.
The only other thing that comes to mind is maybe a high opportunity on this is reminding folks to report changes. If that happens, their household or income or whatnot, we often get customers who don't report the changes, and then that means bad surprises down the line. Sometimes with claims and losing benefits and such. I don't know if the other counties are doing that. I'm waiting to hear their results, because I'm really glad they're starting to go in that direction.
As a participant, that would be helpful. Like some of the programs, it's report within 2 weeks of the change. Some of it's report by this date. Like that would be helpful for me to be like, don't forget, let us know at this chunk of time. Or even like a random spam-ish one that was like, don't forget to report changes 2 weeks after, within 2 weeks after that. That would be awesome. Because I've gotten in trouble for that. So that would be great.
There's so many different details to keep track.
Yep.
That's impossible.
This is Patty with the Family Resource Center Association. I think also along with a reminder, appointment reminders, kind of a list of what they need to bring to their appointment would be helpful. If it was a quick text message, not make it too long, but just reminding them what they need to bring or what they would need for the recertification as well.
Yeah, the WIC one said, my last one is bring your child, bring your proof of income. So I really like that too. That helps me.
Great, thank you so much.
So what this is Kiki, I'm trying to discern is this a workforce strategy issue? So Todd, I might need your help here a little bit. Like we need all eligibility texts to text their clients, or is it a technology issue, like we need CBMS to auto remind people through text, which I don't know for one capable of doing, or two, I'm trying to also think of like what's allowable, right, in terms of the way we interact with our clients. So can someone help me parse out what they think the strategy here is if it's workforce or technology or a combination of both?
I mean, I can speak a little bit to like how WIC has
Sure,
implemented it, and then maybe you can see what's relevant for SNAP. I mean, I think WIC, we've done it at a statewide system level, so
Okay.
it pulls data from our management information system for WIC and texts clients based on that information. If you were trying to do that manually, it creates a lot more work. So I don't think that would be a feasible strategy.
So all your work management systems across the state are on one work management system? Well, that would
So
be.
all of our client information is in one system, and so we take information from that system. So that's not the same.
Yeah, that's not the same. So Todd, can you speak to that?
I think the answer is probably both. I mean, it's not too complicated, both workforce and technology. I mean, I think workforce because it is good for the counties to be able to have those communications directly with the clients.
For sure.
I would add one to it. Maybe we're just unusual, but the reason Denver hasn't done this as quickly as the other counties, we do have an IT project in the works to be able to do this, but we actually had a legal question locally. So our, we had our state attorney had a certain perspective on what we could do locally around this or not. But to resolve that, I think that it was much easier. So anyway, but to answer your question, yeah, I think again, relatively low barrier, high feasibility.
I want to temper that a little bit, just to say, unlike WIC, who, I could be wrong because I don't operate in CDMS every day, but we don't have people's appointments in CDMS. So that would be in your work management system or Arapahoe's work management system. So the one thing I'm trying to just be clear about is feasibility from a technology solution is not hard, but feasibility of quickly making the state there is harder if it's not all in one system already.
Yeah, I think high feasibility depending on the county, then in other words.
That's what I just want to be clear about.
Yeah, I think it's, as I said earlier, I think maybe better as a local solution.
And I think that's a great point. The interview time is not necessarily, but the redetermination time is in CDMS.
Okay.
So it may be that it's highly feasible for some certain parts of what this could do, redeterminations, change reminders, but you're right, the appointments, it's not as easy.
Okay.
Or maybe not possible. Yeah.
Thanks, Matt.
This is Alexis. I have a similar question to what I asked around the telephonic signatures. So this does sound like it's a local solution that would probably need to occur county by county. Or maybe there's some economy of scale, but I guess right now is the barrier to implementing this or uptake at certain county level, is it resources, is it workforce, what would be the solution? Is it a funding solution, is it a training solution?
I think it's a decision point for counties, I don't want to say this is a barrier, right, but the way it would work is counties would individually have to decide because some of the data does not reside in a statewide system, whereas telephonic signature I actually think could be a statewide solution because
statewide, this one.
That technology could be owned by the state, whereas I don't know for Denver County or Arapahoe County when Susie's coming in for her interview, and I couldn't know that at a statewide level.
What about the recertification reminders?
That has potential.
So some of this could be statewide. The economies of scale of having technology is the other thing. What is the technology we use to send those messages? There may be a really good economy of scale by having that as a statewide technology.
Yeah.
That they could be used by the state for statewide things. If it was agreed, for example, that statewide reminders should go out about determination dates.
Right.
Locals could also possibly opt into that technology. If they have local messages they want to send, it may be more efficient for the state to host that solution.
Okay.
Just something you might be able to, next month or two, try to price out?
I'm gonna get that together a day, Jack.
So
I feel like impact is high, but feasibility to me is a little more questionable about high. I think it's medium in my mind.
So let's think about impact too in terms of increasing and maintaining SNAP and WIC enrollment, just to revisit. What did you see impact in WIC, Erin, in terms of your numbers? Did you have evaluation data on texting?
So
Erin
Erin Kendrick, you're probably the best poised to answer this.
In terms of no-show rates?
Or
We did see it, yeah, so it was evaluated in terms of no-show rates, and so we did see an improvement with that. So that was good news, and that also saved a lot of time on the local agencies' end, because a lot of them, when someone would no-show, they would do a phone call and try to, reschedule them, et cetera. So we did have a text that if someone missed an appointment, it would cue them to contact the clinic as well. So, but that did positively impact no-show rates. And then in terms of enrollment, we did not use it to, enroll participants because it was just going out to active families.
Erin, this is Gina. Do you know if it was like a statistically significant improvement by any chance? I know you had some research done, so I was just curious.
Yeah, I don't have that information at my fingertips, but I can look into it. But I do think it was significant. Not off the charts, but I will definitely put it on my to-do list and get back to you on that one because I know they evaluated it.
So one additional point that I don't think has come up unless I missed it, verification, return to verification is another fairly good opportunity here. When we tell them they need to bring back or send us back something so that we can improve their benefits, that's another reminder that might be very useful. And it's also statewide information that goes to the CDMS for they need this to turn in by this time. So it's not local.
Okay, so I was hearing high impact. Feasibility sounds mixed depending on the county key. Is that what you were thinking?
Or from like a statewide solution versus.
So maybe should we just label this as a statewide and then consider it in that light for right now?
No. That is the group's, I'm not sure.
Well, in terms of the recertifications, to your point about the missing verifications and the general mass reminders about reporting changes, that's all on CBMS. So I'm good with maybe pursuing this idea through the lens that it would be a statewide effort. The only thing we're missing with that is the interview reminders.
People feel comfortable kind of just defining this a little more as a statewide approach for right now?
They're not mutually exclusive.
And where would you put that on the feasibility?
I think there are just more things that need to be thought through here. I'm not.
I said high, I'm not gonna change it.
I think it's,
Yeah.
I think it's a medium.
I would just add too that maybe it's statewide, but
go together.
as Matt was sharing, maybe we could have a county opt-in approach to that as well. Like this, overall a statewide effort, counties can be able to opt in to that accomplish.
Not their work management system.
I went ahead. Okay, so we have medium on that. Right in the middle. Voluntary ENT. Don't know what that means.
It's really.
You?
Yes, I can cover this one. So Employment First is the employment and training program that goes along with SNAP program. And states have a good amount of flexibility in how they run that and how it ends up impacting clients. So what we've done in Colorado is counties have the opportunity to choose if they run a voluntary, a hybrid, or a mandatory program. And what that means is anyone who's a work registrant by SNAP rules in a mandatory county, they'll get referred to Employment First. If they don't comply, they will be sanctioned. They will lose benefits. In hybrid counties, if someone is a work registrant, but not an ABOD, which is sort of a population within that work registrant population, able-bodied adults without dependents, they would have the opportunity to participate in Employment First, but they wouldn't be sanctioned if they didn't comply with it. However, the program would be mandatory if someone was an ABOD, and then in fully voluntary counties, the program is available but voluntary to both groups. However, people could still face that 3-month time limit if they're an able-bodied adult without dependents. So federal rules require that that population has to meet the work requirement. Otherwise, they can only access 3 months of SNAP benefits in a 3-year period. So this would be pushing for a more complete adoption of the voluntary program.
What's the current breakdown in the state?
So 27 counties run mandatory programs, 5 operate hybrid, 5 operate voluntary, and then the remaining counties, one of them has a waiver and so doesn't have a program because of, I think, high unemployment. And then the rest, there's a state contracted program, which is kind of voluntary, I believe. Terry and Keith can correct me if I'm wrong.
Yeah, so Terry's on the line and can speak to some of our efforts on this already, just to catch the group up.
Yeah, so we have been actively reviewing how we are doing employment and training in the state. And we have a couple weeks ago, EB, our Employments and Benefits Division, gave a presentation to the counties and talked in regard to switching to a voluntary program statewide. And that is where we have decided to head, is that we will be doing all voluntary E&T for the state. Just a couple pieces of clarification. E&T applies to people who are not what we call ABODs, able-bodied adults without dependents. Those are people who are 18 to 49 who are living in a household that does not have any children. Even if we are a voluntary program, we are still require those individuals who are considered ABODs are still subject to their additional work requirements. So that would not, our switch to voluntary does not alleviate that work requirement from the able-bodied adults without dependents. Basically what it means for that population is they get 3 months of benefits without meeting a work requirement, and the idea is those 3 months gives them an opportunity to find a way to meet the work requirement, whether that's through voluntary work, through an E&T type program, through school, through work, various things like that. So we would still have a statewide program that these ABODs could participate in order to meet their requirement, but we would not be requiring people who are not ABODs to additional work requirements. It's kind of convoluted. I don't know if that made sense, but that's the direction we're headed.
Well, that sounds like high feasibility then. That's great.
Can I ask, so it's related, but a little bit different from enacting this policy, but if this group has any thoughts or ways that they can be supportive on this. As we make this move, one of the things you know about Colorado with its state supervised county administered system is that that's 64 different entities that have to operate a thing, right? Whether that be SNAP or TANF. But in this case, 64 different entities that need to operate an Employment First program. And one of the things we know is that Employment First turns off and on by county, depending on employment rates, et cetera. And so it's pretty difficult for some of our small and rural counties to stand up a program, turn it off, stand up a program, turn it off, which is why last year we implemented a statewide model. And at the state, we attempted to go out and have somebody bid on a statewide contract to hold up. It was 20 something counties at the time. We failed that RFP twice, I want to say, and then ended up taking the program in-house and managing it internally. That RFP is going to go live again, or is maybe even currently live. But one of the things that on the webinars that we had with counties where we said we'd like to move towards a voluntary model is also that if we don't get a statewide vendor to bid this year, that we think we might have to go back to where counties individually manage each of their programs. And that's really not where small and rural counties want to be, right? Like it is, you don't get a lot of administrative dollars and it's hard to turn a program off and on. So if in the world, you know, employment vendors who might be interested in going into a statewide contract to stand up an Employment First model for many of these small and rural counties, that's something that we really need a lot of support on, because otherwise I think this is really going to fall to a lot of counties in a way that I don't think is beneficial for our clients. Terry, did I state that correctly?
Yes, that's correct, because we are currently keeping the pledge status, which basically means we have committed to having a program for our ABODs to go to in order to meet the WIC requirement, and that would be the contractor that Key's speaking of.
And do you know when that goes live, or is it live currently?
I will check real quick.
So let's just commit to sending that out to this group. So like, you know, people in the world, this is really, really important to me personally.
Share it on LinkedIn.
Are you gonna
Hundreds of
remain
people will
pledged
see
state
it.
for the long haul?
I don't have intentions not to. Should I?
Any questions or comments on this strategy or approach? Is it still on the table for this group to consider given the landscape?
Terry, is there a role for this group to play that would be helpful as you guys move forward with this?
Well, I think Key's point to the help with the statewide contractor would be significant.
But compared to all these other things, is it something we want to put up here on the matrix, or is it something that?
Well, if it's happening.
Do you have a time frame for when this change is going to be proposed?
Is this part of the rule?
It's part of the state plan that we have to put with the feds. So it's like now, right, Todd?
Yeah, we're aiming for October 1 would be the implementation date.
And our state plan submission is next month.
Does that have to go to the State Human Services Board?
No, it goes to the feds.
They don't have their regulations that would have to change too?
Terry?
Yes, there are some regulations that we would need to update.
Advocacy role be helpful from this group, or? I mean, we really do have this.
It could be. I honestly, when we in the discussions we've had with counties, actually the voluntary model's been pretty supported is how I feel. With a few people maybe that aren't supporting it.
I think it's the key is just getting somebody to do it.
Mm-hmm.
Yeah, it's- you don't want to.
So in the interest of time, I'm kind of going to make a suggestion based on what I'm hearing that this just gets pulled off for right now, because it may not be, it's not to say this group can't continue to support and work and advocate.
I was just going to suggest, this is Alexis, I don't think it would be harmful to have things on our list that we say are priorities, but don't really require active participation, that we could then say, this is happening and check it off. So we may, as we categorize this, we may say like, this is where we want to actively support, but these are things we're monitoring and want to see happen as part of a comprehensive package.
So, aye. So we will keep this as a monitoring priority for the group. How does that sound?
Yeah, but I think it's high. So
Yeah,
like
it's
if
high.
you stick it up there.
All right, there we go.
Well, great work.
And maybe I'll just make a little bit of sense.
Big deal. I took your list very seriously.
Excellent. Okay. So there's two more. I want to check in with the group at this point because we have about 12 minutes left. And I want us all to kind of be on the same page with where we're going to get to and then where we're going to go next. So sorry, we didn't move more quickly, but I think this conversation has been really rich for someone who's not familiar with any of this work. It sounds like it was really productive. So we have household composition clarity and then funding application assistance left. And Jack and Anya, I'm going to turn to you since you're the chairs of the group and say, what is your hope in the next 12 minutes? And knowing we also wanted to have a state update, which we weren't sure we were going to get to that anyway. But so here's what we have left to do. We have to talk about these, put them up there. So there are a lot of follow-up potential data gathering or information gathering pieces for some of these. So some of the pros and cons, if we get through these two and get them up here, which I think we could do, and not like vote or move further anymore today and then bring more information back. My only concern is people will forget in the next 4 weeks everything we just talked about. So the other idea is we talk through these two, and before people walk out the room, people could at least put a dot up in terms of where they're leaning to just get people's initial reactions, knowing that we're still going to need to probably talk through some of the additional information. And then group weigh in as well, what you think, and there might be a third option I'm not even putting out on the table. Sure.
I don't want to shortchange these, but I can say the household composition is something that's on the table. So it's something that the state's looking at. The tough part is figuring out what's an approach that works well. But it's something that would be, I think we can say, high feasibility.
Go ahead and just put that up there.
Unless anyone
We
disagrees.
heard a lot about it in the last meeting in terms of what the
Yeah.
challenges were with it.
I think it will do a lot for client experience, but will actually be fairly low impact for enrollment, but is high feasibility. But I'm open to pushback on that.
How do you want to finish the meeting? And then we can talk more about this, because I don't want to shortchange this either.
We can speed through.
Are people okay with that?
And do you want to have people put their initial kind of thoughts up in terms of prioritizing again? With
You mean of
dots?
prioritizing?
Yeah, like based on what the conversation was, based on what we learned. Narrowing these further by putting some dots up there or no?
We can do that electronically too, right?
Yeah.
I mean, also, it seems like there's a natural
Start,
buckets
yeah.
already, and
Yeah.
one of the three
Yeah.
that are high is already accomplished,
Yeah.
essentially. So it's like.
So that's essentially what we're gonna wind up looking at and kind of talking about.
Yeah, so it's like, then you really only have two.
Well, let's work through these, thank you. So let's work through these. We're not gonna do the dots at all. Let's bring this back to the next meeting, and then we'll just make some final decisions in a large group based on what came out, because it is falling out kind of nicely, although I think there'll still be some interesting discussion points.
I was just gonna offer too, as we parse this out, I think there's some work determining like what this group needs to do versus what the state is doing versus what other partners. So I think, again, the work that this group does there may be things that happen that may not be kind of energy for this group.
So definitely
Or some maybe like a recommendation to the philanthropic community, like, hey, we really need some dollars to support these things, and that may go off and need to happen elsewhere too.
So for whichever ones are prioritized, there'll need to be some sort of planning process.
Sure.
So what's gonna happen, who's responsible, how are we gonna resource it, et cetera. So that is definitely gonna be part of that conversation. Okay, so household composition clarity. We already had a suggestion, but just any other further comments or questions?
We second what Anya and Jack said, so high visibility, we're already working on it, low impact.
Okay. High feasibility. All right, and then funding application assistance. What did this mean, and have we talked about it? What do you all
Like
think?
more than the extra that the state already got last year, guys, come on.
That's SNAP only. Okay, fair.
Yeah, could you coordinate, it could be SNAP, WIC, and Medicaid. SNAP.
On this one too, based on what Sandy was saying earlier about when we were talking about the peak changes, it seems like we were kind of crossing over into a little bit of this territory as well.
I thought so too.
You know, not only sites doing other applications. And we're working together in Denver on a project to look at, you know, I think there is still need to support the capacity of kind of the Hunger Free and the other assistance that's already there. But then is there also a need for like direct enrollment services? So putting some FTE out in the community that can just do the whole, basically an eligibility technician on site. We're exploring that a little bit too. And I think that could use this group's support in terms of both dollars, technical assistance, moral support, whatever.
Measurements, yeah.
And I guess that we have yet to talk about all the efforts that the state departments are engaging in to do that. I wouldn't call it application assistance per se, but application targeting. So there's a whole swath of things that we're doing that we haven't talked about. So I would kind of put that in high feasibility, high impact. Todd, what are your thoughts? Gut check that.
I would probably do low, I think.
Low.
Well, it's going to take a lot of money to do funding application assistance, so that's going to make it a challenge. And then I just feel like it's going to be tough to scale up. So you think about how many people, we're talking about tens of thousands, hundreds of thousands of people who are eligible, who aren't enrolled, and how many clients could one application assistant reach? I just don't know if it's going to move the dial that much.
Oh, this is why I came, was to fight. Hard disagree.
I'd say high, if I was using the same sort of barometer of high for the other ones in terms of grabbing more folks on the programs, because I think for me, the notion here is that we're going out to the community where people are to sign them up and to help them stay enrolled. And those are folks that don't necessarily
Yeah, I think when done right, it can increase program perception and trust with county offices, which can be slow in moving the needle, but is really important.
I have a lot of confidence in this conversation we're having in terms of the healthcare setting and the
Yep.
hospital. I think I think we are going to see some results there, but we have to measure it.
And I think your stars are aligned right now. And again, we don't have time to talk about this today, between Medicaid and food assistance and higher ed and CDPAG and our outreach partners growing. I think we have a lot of potential, and I think this is the solution. I mean, Brett and I have talked about this, that I think boots on the ground is going to be the thing that we have to do to get people enrolled, and we're moving in that direction. So I feel really positive about this one.
We can probably argue about impact, but feasibility is certainly high. It's happening. State partners are investing in it. And I would argue that it is high impact relative to everything else we've talked about here.
He's going to mediate.
Yeah, well, I also, have a bit of a conflict of interest in this, right? Because that's part of what we do. But,
Thank you for sharing that.
but relative to the expense of the increased benefit, I think probably this is a more efficient way to get people enrolled. Relative to solving hunger, maybe that's a different question. Maybe those dollars are better spent on higher benefits. I don't know. It's an open question. But anyway, I would argue for a high, but certainly high feasibility.
Sounds like those who have an opinion on this have weighed in. Anybody else?
I just offer from the experience with Medicaid outreach and enrollment following the Medicaid expansion, having those boots on the ground, I think was the most effective way to help get people enrolled. So I'd agree. High impact.
Do you want to change your vote?
I can be persuaded otherwise. Our very first work group meeting, we looked at the numbers from the outreach partners, right? And they weren't, as a percentage, they weren't great, right? I mean, most of the people who were being contacted were not ultimately enrolled. And so anyway, I haven't seen the data that really leads me to think this is the best approach, but I can withdraw.
So I think what you gotta weigh that against is what else is working. And there's a lot more that needs to happen. You're absolutely right. Like when you look at the need versus our effects so far, we've got a long ways to go. But when you compare it to like, okay, and here's the other things we've done as a state and a system that have really moved the needle on this. I'm not sure there are other things that are like, oh wow, that works way better. Let's put everybody there.
I think, Jack, the other thing I agree with what Brett's saying, and I think we're learning more about what's working and not working as part of the process, and that's where we need to share metrics and be able to say, how are you implementing this or that, and learn from one another. But I think that's where the different role model of not having the multiple drop-offs, but go to direct on-site enrollment in populations, high Medicaid populations, for instance, at a county hospital would make sense to do that in addition to what's already. But I try some different things and then compare all of that. How much does it cost to get this number of people enrolled, and who are we enrolling as a result of each program? I think that's what's really needed to understand that.
There's also a qualitative piece here. And, a lot of times we look at an app as an app as an app, but getting an application in certain communities is more difficult than in other communities. And so it's absolutely important for us to.
But it has to be context specific.
Yes. Yep. And measure like things. Rural areas we think are just more expensive to get an application in. And the strategy there might look a little bit different than in urban areas.
The group has spoken.
The group has spoken. Okay, so here's what we're gonna do. My gut is telling me we're not gonna make a decision today, but I do wanna just share what was in the high. So high feasibility, high impact. And then I think we can all think about this, bring back, for all of those of you who have volunteered to go check on a piece of data or information, we'll systematically go through each of these and you can share what that is at the next meeting, at the beginning of the meeting. And then we'll just revisit this matrix and really, do some gut check, maybe come up and take a picture if you'd like, so you can think about it. If you want to make an argument at the next meeting that that some of these might be the way we would go. Usually what happens is groups go for what's up here, but not always. So this is all food for thought. So funding, application, targeting, and assistance, voluntary ENT as a monitoring role for this group, improving cross-referral coordination, and then the telephonic signatures to counties. And then here in the middle, we had statewide text communications with the county opt-in, peak system improvements in many forms and fashions. Higher minimum benefit was down here under high impact with lower feasibility. And then up here in high feasibility and lower impact was the household composition clarity. So feel free to come up and take a little snapshot, and I will leave you with thinking about all of this and where you think the group should really focus and how much you think the group should focus on. For the next meeting, does that sound good?
Sounds great.
Rather than rushing through decision making.
Yeah.
With 1 minute left.
I'm sorry we didn't have any time left over for general updates. Like, there's something very quick that you all want to share?
Can I share something very quick? We've heard that there will be a federal proposal quite soon to roll back broad-based categorical eligibility, which is how we raise the income level, or the income limit for SNAP to 200% in Colorado. So obviously this would be really devastating. We will be coordinating comments in opposition to that and don't have a firm timeline, but we do know that there's a USDA press call this week. So we'll keep this group updated. And would it be okay with folks in the room if we took 10 or 15 minutes of a future meeting to think about a response to this? Yeah. Okay. Womp. That's all.
And just a final thank you for all of your great thinking and concentration today. This was a lot of work, and I really appreciate you staying engaged, especially those on the phone as well.
So Gina, I just wanted to mention that we did hire a director for the Food and Energy Assistance Division, Carla Marasini. Many of you might know her from currently at Goodwill, but prior has been at USDA FNS as well as with Governor Hick. So you guys will be meeting her and seeing her in the next few weeks. She starts August 5th.
Congratulations. Oh, one other really quick update, I'm sorry, but this group has talked a lot about the chilling effect, and I want to let you know that we have updated materials on public charge and food assistance and immigrants. I have a couple copies here, but I'll also send them out to the group.
Thank you, Gina. Thanks, everyone. Like, I wrote action items for myself down, but I also wrote down different action items. But I forgot. Does somebody say
Let's talk about
Hey, for that, thank you so much. Just a couple thoughts, like, I'm wondering, like, do you need us to check the,
I'll check it.
Yeah, there was one that was really interested in that funding. I agree.
So, the group is called, oh, yeah,
I guess
I wanted to tell you, I sent your resident agenda and then help
I think
that's something I did. Like, I think he has to know how to work plan. He was like, hey, got it, I'll pass it on for you. And then it's all.
This should be like,
I feel like,
again,
not only is it also know, but it's also like.
I'm checking. Isn't that?
Just keep plugging it through. Like, we were just looking at the OIT website too to see, like, there's a couple of jobs that developers 2 and like database administrator 2 that we're not like at
not
the
there
2
yet,
levels.
yeah.
We're trying to find the like, this is like the only
You find the meeting, you find the meeting for the state.
I think, but you know, and maybe they, I mean, I think right now. Or they say a lot of it is like you have to have a degree.
I know what it is.
Yeah, like nothing for long learning.